lesson, we're going to talk about second degree AV heart block type 1. So there's actually two types of second degree blocks. There is type 1 and there is type 2. So in this lesson, we're going to cover type 1. And type 1 has a couple other names. It is also called Mobitz 1, and it is also called Winky-Bach. So these are actually named after the people that discovered them, and they're here to make our life hard. But we're going to keep it simple so that at the end of this lesson, you're going to be able to, at the end of these two lessons, you're going to be able to understand the difference between these two so that when you see that on an EKG, you know and you're able to differentiate and identify them. So just so you know, also type 2 is also called Mobitz 2. Again, you'll learn to be able to tell the difference and understand them easier. So let's go ahead and get started and talk about second degree AV heart block type 1, or also called Mobitz 1, or also called Winky-Bach. So in second degree AV heart block type 1, the atrial impulses have difficulties reaching the ventricles. And this is usually because the AV node is defective. So what happens is here's our heart, here's our SA node, and here's the AV node. So sometimes the AV node delays impulses, just like in first degree heart block. The difference this time is that it gets by regularly, and other times it takes longer for the impulses to get down to the ventricles. So this is actually measured with the PR interval. If you remember a normal PR interval, it is from 0.12 to 0.20 seconds. And this is actually what a PR interval is how long it takes for the electricity to travel from the atria down to the ventricles. So again, normal 0.12 to 0.20. So in second degree AV heart block type 1, what happens is the AV node lets some of the impulses get by at a normal speed, and others it takes longer for them to get down to the ventricles, and even longer. And sometimes it blocks it completely so that the signal does not get down to the ventricle and the ventricle does not contract, and we do not have a QRS. So let me show you on this strip right here. If you look at this PR interval, it's actually about 0.0 seconds. This one is about 0.28 seconds, and this one is 0.40 seconds. So you can see how the PR interval is getting longer. And then what happens here? Here's our P wave. We would have a QRS somewhere around here, but we don't. So our QRS complex is dropped. Okay, so we drop a QRS. And then what happens is it picks back up again. So here's our P wave and then our QRS. And you can see that the PR interval is getting longer from this one to this one to this one. And here we would have a QRS, but again, it's dropped and you just can't see it because this strip isn't that long. So the PR interval keeps getting longer, QRS is dropped. And then it starts back up again. It's a cycle. PR interval gets longer, QRS is dropped. So let's break down the characteristics a little further and do the 6-step method. Number 1, we got to look at the rhythm and find out if our rhythm is regular or irregular. So from here to here, we actually have about 21, 22 boxes. From here to here, we have about the same, about 21 boxes. So our rhythm is regular. However, when we dropped a QRS, we have about 37 boxes from this R wave to this R wave. So our rhythm is regular, but it is irregular when our QRS is dropped. In step number 2, we got to count the heart rate. So we have 1, 2, 3, 4, 5, 6. 6 times 10 is 60. Now, the 1500 method wouldn't be accurate here because it's irregular. So we would count the apical heart rate for a full minute. And then in step 3, we got to do the P to QRS ratio. Do we have a 1-to-1 ratio? Do we have one P wave followed by one QRS? And here we do, here we do, here we do. However, here we don't. So our P to QRS ratio is 1-to-1, but it also varies because when we drop a QRS, obviously it's not 1-to-1. In step number 4, we got to look at the PR interval. So in step number 4, we got to look at the PR interval. So again, from here to here, it's 0.20. Here it's 0.28. Here it's 0.40. And then we drop a QRS. So the PR interval gets longer with each heartbeat. And this right here is the biggest characteristic of second-degree AV heart block type 1. So if you're going to memorize anything, memorize this. PR interval gets longer, and then QRS is dropped. Okay, drop. That's a D. And then in step number 5, we got to look at the QRS complex. So let's go ahead and measure. We'll pick this one. So from here to here, we have about 1.5 boxes. So we'll go with 0.6 seconds. And then in step number 6, we identify the rhythm, which we have second-degree AV heart block type 1. So let's go ahead and recap the characteristics. The rhythm for the most part is regular, but it can be irregular when the QRS is dropped. The rate varies depending on the underlying rhythm, but because it's a block, it will usually be a lower than normal heart rate, or it will be very bradycardic. The P to QRS ratio varies, and we usually have a 1-to-1 until the QRS is dropped. The PR interval gets longer with each heartbeat until a QRS is dropped, and then it starts back up all over again. If you look at this strip here, we have longer, 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 QRS is dropped, and then it picks back up again right here. So longer, 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 and then QRS would be dropped. The best way that I learned this when I was in nursing school was to picture a person jumping and singing a little song. So here's our man. So he's going to be singing winky, winky, bop, and he falls. And then right here, he's going to start all over again. Winky, winky, bop, and he falls. Another way that you can learn this is longer, longer, drop, winky, winky, bop. Okay, so longer, longer, drop, winky, winky, buck. And that is just the best way to remember that the PR interval is longer, longer, and then you drop, and it is winky, winky, buck. Okay, I hope this helps. I know sometimes silly things like that help people remember, so I hope that helps you. So let's go ahead and keep talking about this rhythm. So when patients present with second-degree AV heart block, since it's a relatively harmless rhythm, usually when they come in, they are asymptomatic. And so the main nursing interventions are to continue to monitor them, know the underlying rhythm, and what you got to look out for is just to make sure that they're not very bradycardic. Know the treatments, determine the cause so that you know the treatment. Usually an electrolyte abnormality or DIG toxicity or an MI can cause it. So if you can determine the cause, we can treat the cause. And lastly, if they are symptomatic and bradycardia, then we just go ahead and follow the ACLS protocols. So the key points from this lesson are to remember the abnormalities of second-degree AV heart block. Hold on, it's a long name. Heart block type 1, also called Mobitz 1, also called Winky Buck. And basically the AV node is defective, so it delays the impulse from getting from the atria all the way down to the ventricles. And it does this by progressively prolonging the PR interval. So it gets longer and longer, and then it drops. A QRS is dropped. So winky, winky, bop. Longer, longer, drop. Nursing interventions are just to continue to monitor the patient because usually they are asymptomatic. Treatment, identify and treat the cause if possible, and medications or follow the ACLS guidelines if they are symptomatic and bradycardic. So I hope that you guys have enjoyed this lesson and feel more comfortable Understanding Second Degree Second Degree AV Heart Block Type 1, also called Mobitz 1, also called Winkelbach. Make sure that you guys check out all of the other resources that are attached to this lesson and the cheat sheets, because it will help you become more familiar with this rhythm. And make sure that you keep looking at different EKGs so that you are more comfortable identifying them. Now, make sure that you guys go out and be your best selves today. And as always, happy nursing.